Hi, good morning, everybody. My name is Jessica Sigal. I'm a physical therapist and a certified lymphedema therapist, and it is an honor to be speaking with you today regarding what is lymphedema. Just a quick note about myself. I graduated from Hunter College in 2016, and pretty soon after, in 2017, I got certified as a lymphedema therapist through the Norton School of Lymphatics. I had no idea this was going to kind of take over my practice as a physical therapist, but it really has. And taken a lot of continuing education because I've become really passionate about treating patients with lymphatic dysfunctions, especially patients after cancer treatments. So right now, that's about my entire practice. I have been a member of the National Lymphedema Network since 2019 when I went to my first conference, and it really changed the way I practiced. And every time I go to one of these conferences, it has become something that it adds so much to my practice. So it really is an honor to be here speaking with you guys today to give back to the NLN because they have given me so much. So just a quick word about myself. Our objectives today, we're going to talk about the lymphatic system as a whole because we have to talk about what it is before we can talk about how it malfunctions and it causes lymphedema. We're going to talk about lymphedema, the different stages of it, what causes it. As well, we're going to touch on treatment, but the treatment part is really going to be discussed more so in whole by my colleagues later on today. So what is the lymphatic system? It's a system of organs that's responsible for immune functions as well as fluid balance. So I like to tell my patients that it's as if our immune system and our circulatory system had a baby and it has properties of both, but it is still very individual on its own. It is a vascular system. It has vessels. It also has organelles that do certain functions, and it transports lymphatic fluid. So lymph is a combination of plasma, proteins, lymphocytes, which are a type of white blood cell, cellular waste, and metabolic waste as well as dead bacteria, viruses, and fat. So all of this together creates something called the lymphatic load, and that's what our lymphatic system transports throughout our body. The lymphatic system itself is made up of lymph vessels, lymph nodes, and tissues, as mentioned. And the lymph nodes are these little encapsulated organelles where the lymphocytes or white blood cells they filter out the lymphatic fluid in order to deal with these pathogens. So that's why when you start to have an infection or if you're sick or something, your lymph nodes are going to be more inflamed because they are doing more work. And every person has between 600 to 700 lymph nodes. The literature has really kind of been scattered because we haven't been able to really visualize the lymph nodes so well throughout history, but there's actually a research project being done right now at Emory University where they are going through the cadaver labs after med students, and they are actually dissecting to find out how many lymph nodes these cadavers have. So really fascinating work coming down the line. So our lymphatic system, additionally, it has, we find lymphatic tissue in our bone marrow, our thymus, which is where our fighter T cells kind of live and circulate through. These fighter T cells, they're a type of lymphocyte that actually patrol your body, and then they come back to the thymus. Your spleen, the Walder's throat ring, which is also our tonsils. For many, many years, when people were getting their tonsils taken out, we have now found out that those tonsils are part of our lymphatic system. So doctors are not so quick to remove them anymore. And Peyer's patches, which are these little patches of lymphatic tissue near the small intestines. So our lymph nodes are also clustered in very strategic locations. So along our respiratory tract and our digestive tract. So when you think about it, how do germs enter our body, right? We usually inhale them or we ingest them. So it makes sense that these lymph nodes where we have these lymphocytes that are, that's where the battles really occur between the immune system and the white blood cells. It makes sense that we have all these lymph nodes near these entry points for the pathogens. So that's why we have a lot of them in our neck. Also in our axilla or our armpit and our inguinal region or our groin, because when you think about it, the lymphatic fluid, in your hand per se, if it starts here in your hand and the lymphatic fluid has to go through all these vessels, it makes sense that you have a couple of lymph nodes here at the elbow to start that filtration process before that fluid then goes to your armpit, where you're going to have more lymph nodes to do more filtration. It makes sense to kind of have these little filtration stations along the way. And this is a great picture. I love this schematic just because it kind of shows us the different types of tissue, but also our junctures of lymphatic vessels and lymph tissues. And also right here, you'll see that we have something called the cisterna chyli. And this is where things kind of, the lower extremity and the abdomen, the lymphatic vessels conjoin, and they come together. And then this is something called the thoracic duct right here. And this is the thoracic duct is about the size of a piece of spaghetti. It runs up the anterior aspect of your spine. And this is where the lymphatic fluid is then going to enter into the bloodstream, and it's going to reconstitute with the blood. And I'm going to go over that on the next slide. Also, I want you to appreciate that right around here where the cisterna chyli is also, that's where our diaphragm is. And that's our primary muscle of respiration. And that's why diaphragmatic breathing, which again is going to be talked about more in depth a little bit later on, diaphragmatic breathing is so important, because when we do this diaphragmatic breathing, the lymphatic vessels, it goes through our diaphragm. So that breathing, and that by utilizing that muscle, we're actually massaging our thoracic duct, and we are actually helping that lymphatic fluid move a little bit more efficiently. So it really is a very important part of treating our lymphatic system, and also for just regular overall lymphatic health for those of us who have intact lymphatic systems as well. So lymphatic drainage basics. So this is a diagram from Jobster Essity, which they're very involved in the lymphatic community. And this is something that I use with my patients on a daily basis. So I thought it really illustrates the basics of lymph drainage as a whole well. Over here on the bottom right-hand corner, this is a very elementary basic version of our circulatory system, right? So on the left side of our heart, this red symbolizes oxygenated blood, which leaves the left side of our heart. And when it's here, the blood it's constituted of red blood cells, white blood cells, plasma proteins, medications, all that great stuff. And it goes down through our arteries and then our arterioles. And then here, this purple section, this is our capillary beds, where the oxygen exchange occurs. So we see the lymphatic fluid leaves the capillaries. It kind of washes our tissues, and then the new research tells us that none of it gets picked back up. So then it gets picked up by our lymphatic system. The former research told us that a lot of it got picked up by the venules, but that's not true anymore. So the rest of the blood comes back up through our venules, then to our veins, and then here we see where the lymphatic system it empties into some of the subclavian veins, and it reconstitutes. So the blood and the plasma reconstitute, and then from the right side of our heart, it gets pushed over to the pulmonary system, where again oxygen exchange occurs, and then it comes back to the left side of the heart, and that continues on and on and on. So our lymphatic system will pick up this fluid. If we come back down here, the lymphatic system will pick up the fluid. It will eventually make its way to a lymph node where, these white blood cells are doing their work. And then it will move through the system. And again, like I said, it's going to come up here. It's going to come up here, and it's going to, like I said, reconstitute the blood. So this cross section over here on the upper left hand corner, this is a cross section of one of a leg or an arm or something. And then here we'll see, so this is our skin, this is our muscle tissue, and most of our superficial lymphatics live in the space between the skin and our muscle tissue. And here we see a very, very blown up version of a lymphatic capillary. And you can notice that it's closed here. And well, here too, I know it's kind of small on your screens. These lymphatic capillaries are closed. And what happens is this is a cross section of that capillary. You can see here that they've got these little filaments right on the side. So what happens is those little filaments, as we stretch our skin, the filaments open the lymphatic vessel, and then when we relax it, it closes. So because this is a closed system, and the only place that it's open is here at our veins, where right before the heart. That heart and that system creates a negative pressure in the lymphatic system. So when we open up those lymphatic capillaries, there's low pressure in the capillaries, but there's high pressure outside of them because of the fluid there, and because through osmosis and stuff, we want our bodies just want there to be even pressure. So the high pressure fluid is going to go into the low pressure capillaries. So that's how the fluid gets from the tissue into the capillaries. And that stretch and relax is really important for overall lymphatic movement. And that's going to really play a big part in in the manual lymphatic drainage, and also for long-term treatment for your lymphatic system. That's another reason why we find that exercise is so important, because again, it's stretching and relaxing by using that muscle pump. And so here we can also appreciate that, we have these little itty bitty vessels that come together, and then they get larger and larger as the vessels communicate. And they also run alongside our vascular system because they are cousins, right? As I like to say. But this is a great slide. So again, the fluid enters the capillaries at the tissue level by the opening and the closing of the vessels, and then it moves along through the vessels into larger vessels, filtered at the lymph nodes, and then it progresses to the thoracic duct. If it's from the lower extremity, it goes to the thoracic duct, or if it's from the upper extremity, it goes to the subclavian veins. And it is a negative pressure system. Again, and that's also going to be a reason why it's important to apply external compression sometimes. We can also appreciate how if there's some sort of an injury to the system anywhere along the lines, that's going to impede the negative pressure and that suction capability. So that is why we're going to also need external compression. Lymphatic watersheds. So basically our body, the lymphatic system, it's broken up into these linear areas and their drainage territories. So basically there's one watershed, there's a sagittal line, there's one that goes across your abdomen at the level of your belly button, your umbilicus. And this is why, if you have lymph nodes removed from your left armpit, you may have swelling to your left arm, but not necessarily to the right arm. This also plays an important part in lymphatic drainage, how we treat you going forward if you do have an impaired lymphatic system. And again, here, so what we do as therapists too, if someone's impaired on the left side, these are called anastomoses, these green things right here. That's why we're going to utilize those, and we're going to cross those watersheds to try to help move some of that fluid, because one side may be impaired, and we want to utilize whatever is available to us to help mobilize that fluid. So what is lymphedema? Lymphedema is a chronic swelling that occurs to impaired functioning of the lymphatic system. Hopefully, through the diagrams and through my explanation of the lymphatic system, we can understand that, when we have an injury of some sort, that plumbing system isn't going to work so well. Lymphedema is treatable, it is manageable, but at this time it is not curable. That may change in the future, but as of right now, it is not curable. There are two different types of lymphedema. There are people who are born with lymphatic dysfunction, people who have primary lymphedema. That means that either there was a blockage, or maybe your lymphatic system wasn't as developed as other people's. And then there is secondary lymphedema, which is caused by damage to the system. So this would happen after trauma, which is one of the most common causes. And trauma can include surgery, radiation, or even accidents. A lot of the times when we think about cancer-related lymphedema, it's because of the combination of the surgery and the radiation, certain medications also. But we can't rule out accidents as well. I had one patient who was a paratrooper, and he, for years, would have these terrible incidents of really bad swelling in his legs. And he would end up in the hospital with cellulitis, and it was so bad, and no one could figure out what was going on. He had lymphedema because through all those accidents of being a paratrooper, he had so much trauma to his system that sometimes it would just flare up. And thankfully now he's doing really, really well. But no one could figure it out because he didn't have surgery and he didn't have radiation. He didn't have these, typical causes. But yeah, so certain medications, we know that taxane-based chemotherapies can increase the chances of developing lymphedema. Cellulitis is an infection of the skin which damages your lymphatic system. So this on its own can cause lymphedema. I have seen it a number of times. I'm sure any other therapist can attest to this as well. Unfortunately, when your lymphatic system is impaired, you are also more prone to developing cellulitis. So that's why it's really important that we take meticulous care of our skin, and we are very proactive about infection prevention. Vascular disease can be a cause of lymphedema because if our vascular system, the lymphatic system and the vascular system work hand in hand for circulation. So if there's a breakdown on one end, it's only a matter of time before the lymphatic system is not able to compensate for that. Obesity is a cause because of the extra pressure, that the extra weight is putting onto our lymphatic system. And unfortunately, that often goes along with a sedentary lifestyle. As we saw with the diagrams, you have your lymphatic system throughout your entire body. When you have a sedentary lifestyle and you're not moving often, number one, we're not utilizing those muscle pumps and we're not stretching and relaxing that skin. But also, just by sitting, when you think about our lymphatic vessels, you're kinking the hoses, right? When you're sitting down all the time, we're kinking the hoses at the knees, at the hips. We have a lot of lymph nodes there also in the hips, both anterior and posterior. So if we're sitting all the time, unfortunately, those lymph nodes are not getting that input that they need. And all of these together, unfortunately, can cause lymphedema. There are different stages of lymphedema. On stage 0 is what we consider to be the impaired lymphatic system. So this could be someone who had lymph nodes removed and they had an infection and they had radiation, but they don't have swelling yet. So we know that something may be brewing, but this patient does not have swelling yet. Stage 1, we consider to be spontaneously reversing, where it's going to come and go on its own, and we don't have to necessarily treat it. It helps if we treat it and stage 1 can still go back to stage 0. So stage 1 can go back to stage 0, and you could be at stage 0 for a very, very long time, and maybe you'll have another flare here and there. But we want to really make sure that if you are a stage 1, that we do everything we can to give you the tools to get back to a stage 0. Stage 2 is when it starts progressing. This swelling no longer returns. It no longer goes down on its own. This patient requires intervention. They are not able to get the swelling down without help. And later on in stage 2, once that swelling becomes more chronic, we start to develop skin changes such as fibrosis. So basically, I like to explain it as if our skin is a smart balloon, right? If a balloon keeps getting more and more pressure in it and it's more and more filled, it's going to pop. Our skin has enough sense to say, hey, I have this extra swelling, it's not going anywhere. So we need to put down some extra foundation. We need to put down some extra collagen and elastin and make sure that we have enough structure to maintain this extra pressure. So the skin starts to get hard because of this extra collagen that's being put down. And then, unfortunately, if we don't do anything about it, it's going to progress to stage 3. So stage 3 would be over here on the right. We consider this to be elephantiasis. You have excessive swelling with skin changes such as fibrosis. Also, if it's not taken care of, we can develop hyperkeratosis, which is like almost like a scaliness of the skin. And there's other types of skin changes. So with this, you can have skin breakdown also and weeping, because eventually your skin is going to say, I can't take this anymore, and it needs to alleviate some of the pressure by weeping. And we hope that it doesn't have to get to stage 3. Um, we would like, ideally, in a perfect world, we would see these patients at stage 0. Sometimes people don't realize they have swelling until a little bit later on, and the further on we are in stages, the longer the treatment is going to take, because before we can really manage the swelling of someone who has a lot of fibrosis, a lot of the times the fibrosis will have to be managed first. And we do that through complete decongestive therapy, as well as some sorts of manual therapy. So how do we treat lymphedema? We treat it through something called complete decongestive therapy. So manual lymphatic drainage, what we refer to as MLD, it was first developed by Emil Vater, who this was a PhD, and he manipulated swollen lymph nodes of chronically ill patients, and it actually showed that he had some pretty good effect. So, and once Johann Osdonk, this all occurred in France and Germany. He heard about this. He was a physician. He heard about it, and he went to go work with Dr. Vater, and the two of them created their first school for manual lymphatic drainage, and they kind of expanded it into something called complete decongestive therapy. And then in 1989, Michael Foldy, he published Foldy's first textbook of lymphology. We consider him to be the father of modern lymphology, because he did extensive research on the lymphatic system. For a long time, the lymphatic system couldn't be visualized. We didn't know what it was. And Dr. Foldy and his research, they really opened up so many barriers for patients, for therapists, for physicians, the whole world of lymphology. He still has a clinic. He has passed away, but his clinic still exists in Germany, and they really are considered to be like the gold standard and the best of the best when it comes to lymphatics. What is complete decongestive therapy? There's 4 pillars. One of them is manual lymphatic drainage, which is a manual manipulation of the lymphatic fluid. We mobilize it from one area to another, and some of my colleagues will be going more in depth into this. Compression, skin care, and exercise. So there are 2 different phases of complete decongestive therapy. The first is the acute phase, or the reduction phase. In a perfect world, and what the Foldies and the Vater technique teaches, in a perfect world, we would see a patient 5 times a week for the first 2 weeks, doing MLD, compression, skin care, and exercise. And then we would taper them off. It would be amazing if we could see our patients 5 times a week, but unfortunately, that doesn't always work out. So that's why it's really important that you work with a certified lymphedema therapist in order to create a treatment plan that is best for you. So after the reduction phase, then you're going to move on to the maintenance phase. And the maintenance phase is going to go on for as long as necessary, which could be, lymphedema is a chronic progressive illness. So we want to keep you in maintenance forever. That doesn't mean that we don't have flare-ups and we need to come back into therapy sometimes to do the acute phase again. So this is a graphic that I got from the NLN, and it really shows beautifully the 2 phases and how the 4 pillars are parallel but different in each phase. So in phase 1, you're going to have manual lymphatic drainage. So this is going to be with you and with a certified lymphedema therapist. You are going to have compression via multi-layer compression bandaging. This is the gold standard to do the multi-layer compression bandaging, because every time we bandage you, it is a custom compression garment for you. It really molds to your body, and it's important and the multi-layers are really important in reducing not only the fibrosis, but also the swelling. We have exercise. Here we see the patient is exercising in their multi-layer compression bandaging, and skin or wound care. So, because of the risk of cellulitis with the population of people with impaired lymphatic system, it is really important to take care of our skin and also to manage the wounds appropriately in order to prevent infections, treat infections, and take care of it as well as possible. So, once you are reduced and you've reached maximum reduction, then you would move on to the maintenance phase. So the maintenance phase still has these same four pillars, but they're going to look very different. So manual lymphatic drainage is still going to occur either through self MLD, or people will also use pneumatic compression devices, which obviously working with a certified lymphedema therapist, you're going to find out which one is appropriate for you. Skincare again, this is going to be self skincare. We always have to take care of our skin. Our skin is our largest organ in our body, but it's also our barrier to prevent infections from entering our body. And it's also where the lymphatic system lives, right? Like it lives below between the skin and our muscle tissue. Exercise is going to continue, and compression garments. So these may be custom compression garments, custom flat knit. They may be circular knit garments, and there are people who are going to go more in depth about these. Some patients are not able to get into compression garments, so we may use a Velcro wrap for them. And again, no one thing is best for everybody. There's no one size fits all. And that's why it's really important that you work with a certified lymphedema therapist to find out which compression garments are going to be the most appropriate for you. So this is complete decongestive therapy. And if you have a flare up, then we go back into the decongestion phase, and hopefully we try to keep you in the maintenance phase long term. So this is just another quick breakdown about manual lymphatic drainage. It's a manual therapy sequence, which helps to stimulate the lymphatic system. And again, it moves the fluid away from the affected tissue. It can also be analgesic, meaning that it reduces pain. It is also beneficial in helping with radiation fibrosis. Compression can be either through multi-layer bandaging or garments, and it increases the pressure gradient from the external to the internal, from outside of the lymphatic capillary to inside of the lymphatic capillary. Meticulous skin care and exercise assists through fluid mobility through utilizing the muscle pump. And when you think about it, the combination of the external compression as well as the internal compression that's being provided from the muscle pump, it really helps to mobilize the fluid. And exercise is a very integral part of long-term management of lymphedema. Please stay tuned. There's a lot more information coming up from the other presenters regarding the different facets of complete decongestive therapy. Thank you.
So today I'm going to be talking to you about manual lymphatic drainage. I'm going to explain what it is and what the proper definition of it is, for those of you who don't know. My name's Elissa, and today we're going to talk about where the origin of manual lymphatic drainage came from, what it should look like when you're receiving it during therapy, and going to discuss a little bit of home care, self-care, manual MLD, and how to find yourself a therapist if needed. So to start, it is defined by Emil and Astrid Vater. In 1932, they coined the phrase lymph drainage massage. And they did this after manipulating the swollen lymph nodes of some of their patients who had chronic illnesses like colds and sinus infections. And they found that by manipulating these lymph nodes that they were able to relieve some of their symptoms and help them to recover faster. These techniques are always a gentle technique. They're used to activate your lymphatic system. So this is especially used when your lymphatic system's abilities are reduced, whether it's due to surgery, radiation therapy, injuries, or any systemic illnesses you might be suffering with. And there are 4 techniques that we use. They are called a stationary circle, a pump, a rotary, and a scoop. You won't necessarily know the difference between the two. This is just what your therapist uses. For each technique, though, we do have a working phase and a resting phase, and you'll be able to feel that when it's done correctly. And I'll show you what that means in a little bit. I have a video to show you. Now, something that we always say is that MLD is not a massage. A true massage comes from the Greek for masso or massein, and that means to knead. And it's used to describe techniques that are used to treat ailments like muscle aches, injuries to the tendons and ligaments, and we're trying to achieve a desired effect. And usually the pressure is much firmer than you'll feel in a traditional manual lymphatic drainage session. So MLD, it is gentle. It's designed to have an effect on the lymphatic fluid and the structures of the lymphatic system, which are right under the surface of your skin. So we're not going deep because we don't want to irritate those very sensitive structures. And there's different theories and techniques that some of the schools teach therapists how to perform MLD. And we as therapists will then adapt our techniques to each person. And we do this depending on what we see, whether there's tissue changes, if their tissue is fibrosed from radiation, if it's thick, or if it's fragile or irritated, young, old. We will definitely change our techniques based on the findings that we see when somebody's in front of us. So I mentioned before the working phase, and what this part of the therapy looks like, it's a skin stretch. And this working phase is what's going to move that fluid towards the lymph nodes that we want them to go. The pressure, again, is tissue dependent. So what that means is it's strong enough to stretch your skin to the capacity that it can move, and it's gentle enough not to cause redness. We don't want to cause any irritation. We don't want to just cause any redness in the skin where somebody is already sensitive. It's used as part of the complete decongestive therapy as a whole for the treatment of lymphedema. And the complete decongestive therapy on a whole includes MLD, compression bandaging, exercise, garment measuring and fitting, and skin care. And it can also be used by itself for other conditions, like I mentioned. So we use MLD traditionally for lymphedema, yes, but it can also be used in injury swelling, such as ankle sprains or soft tissue injuries. You can use it post-surgically in plastic surgery when people have facelifts, breast reductions and enhancements, total joint replacements. There's been quite a bit of success using MLD after total knee replacement surgeries. It just helps to alleviate some of that immediate edema, which will then allow for further mobility of that joint, which is exactly what the surgeons want. And then it also reduces some pain. In the oncology or cancer settings, we use it post-surgically for edema reduction, for pain control. The belly part of it can be used to relieve constipation. It can be used it provides relaxation, improved sleep, and it can also help to reduce stress. It's a really nice, soothing, calming type of therapy. And some other conditions that we use this for, such as autoimmune disorders, Lyme's disease, fibromyalgia, head colds, sinus infections, headaches, arthritis. We can adapt these techniques and use MLD to help relieve some of these symptoms. It's really, really effective. So again, I said it has very calming effects, calms your sympathetic nervous system, provides for relaxation, and it can also desensitize those really hypersensitive surgical scars and radiated skin after treatments. So here's the video I mentioned. Here we're demonstrating what good manual lymphatic drainage should look like. So I want you to notice that his whole hand is moving the skin. So that's his maximum skin contact, and he's getting a good stretch of that skin. He's not pressing extremely hard. His pressure is enough that you can see the skin move. And we say in therapy world that we are doing our techniques with intent and purpose. So we're putting our whole body into this. You can see him moving with his hands. It's not just his hands moving. And he's appropriately stretching that skin. And this will allow for the lymphatic vessels to pull in more fluid from those swollen tissues. Just guiding and assisting those lymphatic vessels along. And this is a traditional technique or sequence that's used for upper extremity lymphedema, an arm, or a breast or chest wall. We also want to think about some contraindications or precautions to consider. So if somebody has a recent blood clot where they're not completely therapeutic on their medications or they're suspicious of a DVT, we want to not do any manual lymphatic drainage to that area. We want to hold off on therapy until the doctors clear them and say that, it's safe. If there's an active infection in the area, cellulitis is very common in lymphedema. So if somebody is actively infected, meaning that they haven't been put on antibiotics yet, or it's only been a day or two and they're still showing redness and heat and warmth, then we don't do manual lymphatic drainage and we wait. Any recent radiation, we're going to avoid those sensitive tissues. So we might do some manual lymphatic drainage on the arm or the leg, depending on where the radiation is, but we won't necessarily go right over those radiated tissues. Any recent abdominal surgeries also is a precaution to take when we're doing the abdominal treatments. We're definitely going to hold off on that. We might have you do some deep breathing while we're doing the therapy, but we won't actually be physically touching the abdomen. Any active tumor sites we're going to avoid, and also implantable devices like a chemo port or a pacemaker or any drains. We're going to avoid those areas as well. My typical environment recommendation is you want to create a nice calming environment. I always say it's the nicest part of their recovery process, of somebody's recovery process. So I want my room to be calm and quiet and dimly lit if possible. I play some nice, gentle music, and we try to minimize interruptions. We put a sign on the door that says to knock, and it provides for a nice setting. Now, as far as treatment goes, when you have lymphedema, we have intensive phase and maintenance phase. And the intensive phase is when you're actively seeing your therapist, and you're seeing them multiple days a week. And the treatment consists of your MLD, your bandaging, exercise, and education, as well as garments and skincare. Now, maintenance phase is when you're home and you have your compression garments, and maybe we've educated you on some self MLD to do every day. You're doing your exercises. So that's what we call maintenance phase, when you're maintaining your reductions that you achieved during the intensive phase. Some people also might receive weekly MLD sessions ongoing by your therapist, and that depends on your needs and your goals and exactly what the therapist is seeing that warrants these ongoing sessions. And that is okay as well. So as far as deep abdominal breathing, one of the therapists is going to talk you through how to do some deep breathing. We will teach self-MLD, like I said. Gentle exercises are always recommended. Swimming, walking, light weights, and all of this is going to be under the direction of your therapist or your doctor. Everybody needs to be cleared first that, everything is healed and you're safe to go and start your exercise program. We're also going to be talking skin and nail care to prevent those infections. So here's some links on how to find a therapist in your area. So I'm not just sending you out on your way. There are resources, especially the NLN has a list on their website that you can access, and you can find somebody in your area, as well as some of the lymphedema training schools. They also have their own lists of people that they've certified. So you can reach out to them and they can help you find somebody in your area as well. You can ask your doctor for a recommendation as well. You will always need a prescription prior to making an appointment for therapy. So just be aware of that. So let's see, that is all I have for you today. These are my references. And again, this is recorded, so you guys can go back and watch that video and look at any of the slides. So thank you.
Good morning and welcome to your interactive breathing session. We are going to focus today on diaphragm breathing, and I want to make sure that everybody knows how to do it, but also knows why I like doing this exercise so much. Our diaphragm muscle sits underneath our rib cage, separating our torso into an upper and a lower half. And this is important to understand because the motion of our diaphragm muscle while we are breathing is going to create some movement within our rib cage and also create a bit of a negative pressure, which is going to help pull fluid from our lower body into our main lymph vessel and back up into our central circulation. So if you understand this anatomy and you understand the function of what the diaphragm muscle is doing as our primary breathing muscle, we can start by doing some diaphragm breaths. What I'd like everybody to do is take one hand and put it on your chest and the other hand and put it on your stomach. When we're doing these breaths, you're going to feel your stomach come in and out. But remember, it's actually the muscle underneath the rib cage that's doing the motion. So first, just take a few normal, relaxed breaths. Feel the air come into your body and into your lungs, and the rise and fall of your chest as well as your tummy. Now, for the next inhalation, I want you to focus on breathing all of that air in and putting it into your tummy. So as you breathe in, your tummy or your abdomen should come out further than your chest wall. So breathe in and fill your abdomen with air. And then exhale and let all of the air out of your belly and your lungs. And again, breathe in and fill your abdomen with air. And exhale. Let all of the air out of your abdomen. So again, breathe in and fill your belly with air. And exhale, breathe out through your lips. And empty all of the air out of your lungs and out of your abdomen. As you continue to do this, you are getting the benefits of improved lymphatic flow and fluid movement throughout your body, but perhaps you are also going to notice that you may feel a little bit dizzy while performing this exercise. Remember, we're taking oxygen in a little bit differently than you do normally, so this is sometimes an expected side effect that people encounter. So if you are feeling dizzy, I want you to stop right away. Remember, our diaphragm is a muscle, and the more we train it and exercise it, the better we will get at using it. So you might be able to only do 1 or even 2 diaphragm breaths. I want you to try practicing this throughout the course of the day. And as you're doing this, you may notice over the course of just 1 day or 2 days or many days that this is an excellent exercise to help promote lymph flow, but only if you can do it safely and without getting dizzy. When you're doing the breaths, I want you to go nice and slow for the inhalation and nice and slow for the exhalation. Continue to do this to help relax yourself, as well as there are connections between our diaphragm muscle and our parasympathetic nervous system, which will keep us cool, calm, and collected as we get through the day's program. This is how our diaphragm muscle is going to be used most effectively for breathing exercises and for lymphatic flow. Thanks, and I'll see you later.
Thank you, Jen. Thank you, ladies, for the presentations. So my topic is going to be on bandaging for lymphedema. And I want to make sure that everyone knows what the gold standard bandage is and why we use it. I want everyone to know what a compression gradient is and how we achieve it with the materials that we use, and also all of the other supplies that might be used during treatment, so you have a better understanding of what is going on your limb. So why do we do compression bandaging? We want to make sure that we do compression bandaging during treatment. It will be done to help reduce new lymph from forming. It is done to improve vascular return. We use bandaging to prevent reflux of lymph that is already in the limb. It does help to reverse fibrosis, which is usually that hardening of the skin when you have the lymph fluids sit in an area too long. So the tissue will become a little bit harder. The bandaging helps to reverse that back to normal. And bandaging also helps to increase the muscle pump efficiency, meaning it helps when you walk or when you exercise. The compression bandaging helps to support that limb to make the fluid move easier out of it. When we apply bandaging, we do use a short stretch bandaging. And a lot of people say, oh, I have that beige bandage at home. It is not the beige bandage that everyone has in their medicine cabinet. Those are probably going to be ACE bandages, which are the opposite of what a short stretch is. So you do not want to use old supplies or something that is not approved as a short stretch. Also, a lot of the bandages come with these metal clips, which you want to make sure you throw away. Anytime you have that pointy, pokey metal object, you're at risk of puncturing the skin and getting a wound and an infection. So those metal clips are always thrown out. We use masking tape instead to fix the bandages. So why do we use a short stretch bandage? A short stretch bandage is made of 100% cotton. There is no elastic in a short stretch bandage. It still has the stretch and recoil, but there's no elastic for that constant squeeze. And you can think of short stretch bandages kind of like the blue jeans, the original blue jeans, the old-fashioned blue jeans. What happens is the cotton, it's the way that the fibers are sewn together that help to give it that stretch and recoil. And so a short stretch bandage has what's called a high working and a low resting pressure. And I'll explain that. Let me talk about some brands first. So just like with shoes or with clothing, there's different brands. So some of the short stretch bandages are Comprelon, Rosidol, Bioform, Low Press, Norbrand. And then some of the long stretch bandages, the most popular one everyone has heard of is the ACE bandage. So here's the difference between what a short stretch bandage does and what a long stretch bandage does. A short stretch bandage will only stretch 50% of its length. So if you have the length already rolled out, when you stretch it, it only moves 50% of that length. So it doesn't stretch that much. A long stretch will stretch 100% to up to 300% of its length. And it does that because of the elastic that's in it. And so these create pressures on a limb, on a muscle. And a short stretch, it has a high working pressure. So what that means is when the bandage is wrapped around a muscle that's working, that's contracting, the bandage will help to increase the resistance, so to help move the fluid out of the vessel. The low resting, when a short stretch is wrapped around the muscle and the bandage is just sitting around the muscle is not working, that there's no squeeze, there's no tourniquet effect. It just is a container that helps prevent the fluid from filling into that area. In contrast, a long stretch pressure has a high resting because the long stretch has elastic in it. When the limb or the muscle is just sitting and not doing anything, this elastic is continually squeezing that muscle, which could cause a tourniquet effect. So when someone's sleeping, you don't want elastic wrapped around their limb. And then a long stretch will have a low working pressure, which means whenever the muscle is contracting or working, that this elastic is bouncing out. And so there's no container for that limb. So it'll just let fluid easily flow in. So when should bandaging happen? It should be started during the intensive phase of CDT, so in the beginning of treatment. You want to make sure the person who is performing it is a certified lymphedema therapist. Ideally, the frequency will be every 24 hours. You put the bandage is put on your limb, you wear it, you take it off to do your skin care, or someone can help you with your skin care, and then the bandage goes back onto the limb. The bandage does not reduce, so that's why you want to have that every 24-hour frequency. The limb will reduce, but the bandage does not. And then bandaging can be done in the maintenance phase. There are a lot of great resources out there. They're making more all the time, coming up with new ways to help with your maintenance. So bandaging can be a part of that, but it does not have to be. So when you have a bandage on, what should happen? Your legs or your arms should get smaller. You should see pretty timely results. So usually within the first 24 hours, 48 hours, you should see some reduction, some skin change. Something should be happening for the positive. When you wear a bandage, you should never have pain. The bandage is going to help protect any of the bony prominences. So you should never have too much pressure against your ankle bone if your ankle is not too swollen. So all the different materials should help protect that. When you take off the bandages, you should perform the meticulous skin care. You also want to make sure when you're wearing the bandage, fluid is not moving to different parts of the body. And then, of course, safety first. So we always assess as therapists if someone is safe to wear it, if their cognition is okay, that they're able to tell if there's pain. We also make sure there's not a fall risk or they're able to do their regular everyday activities while wearing this. So compression gradient. What is a compression gradient? This is where you have more compression distally, furthest away from you, less compression as it works up the limb. And what we want to see is this inverted cone shape. So we want to see a smaller radius distally by the foot or hand and larger as it goes closer to the body. A lot of our limbs are not made like that. We have a lot of curves, maybe some lobules, but we don't usually come looking like this cone. So how do we achieve this gradient? We need to make sure we have more layers distally than you do proximal. You always want to start the bandaging distally. Never start at your knee or never start the bandage at an elbow. There's narrow bandages and wider bandages. So if you have the different widths, you want to have the narrow bandage distally and a wider bandage as you move up the limb. And then constant tension. No one should be really cranking down at the foot and going really light around the thigh. It should be a constant pressure as they put the bandage on. So supporting supplies that help with creating the compression gradient, but also safety. We use foam. Foam is very important. It helps to create this inverted cone shape. Not a lot of us have that shape on our limbs. Cotton is going to help for anti-shearing. Gauze will help for fingers and toes. And we have stockinette, usually applied next to the skin to help absorb any moisture for the comfort. Now we'll go into detail a little bit more. So for foam, why foam? So this is a patient that I've had. We've tried different techniques. We've tried different foam. As I said before, foam will help to create this inverted cone shape. So you might have to pad out some of the areas just to get this shape. Foam helps to break down fibrosis. So you can't really tell in this picture, but this lady had a lot of fibrosis in the lower leg. It was really hard. It didn't indent. It didn't move a lot. But once we used this special foam, it helped to soften underneath and the limbs started to become much softer. The foam is also going to help protect bony prominences. So if you have ankles that are sticking out or eventually after treatment, the foam will help protect that. Cotton is too thin and it will break down too quick. So cotton is not going to be good to help protect the knee or to protect the foot. The foam is going to be your better choice. There's different types of foam. So how thick the foam is, that does matter. They have thick foam, thin foam, textured foam. I had a patient that came to me and said, I have foam at home. I can use mine. And she had furniture foam. A lot different than the foam we use. So it collapses much easier. It's not a good for under compression. So you do want to make sure you talk to your therapist about all of the material that you're using. And the other supporting supplies. So I did mention gauze, pictured here. It's for fingers. You can also use it for toes. It does help to prevent the fluid from going down distally. We use cotton, usually around the joints. It does help for anti-shearing. And then we use different types of stockinette. It will wick moisture from the skin. It will protect the skin from the bandages. And I always recommend some type of footwear or handwear to protect the bandages because they are reused. So you don't want to, do the dishes, take off the bandages, and then not have, unless you have a second set. So footwear and handwear are always good to have while you're doing the intensive phase. And that is it. If you have any questions, you can always email NLN.
I'm Anna, and I would like to thank you for joining me. And a special thank you to the NLN for allowing me to speak about a favorite topic of mine, which is skincare. I hope by the end of this presentation, you will understand the importance of meticulous skincare, and you will know more tips and strategies for skincare with lymphedema. Skincare is one of the main components of complete decongestive therapy, which is the gold standard for lymphedema treatment. While it is a main area of treatment, it does not get the attention that some of the other topics such as manual lymphatic drainage and compression get. A contributing factor may be that health providers believe patients already know what the expectation is for skincare, which includes cleansing and moisturizing. There is so much more to skincare when you have lymphedema, and all the components of CDT are important for skincare. Let's talk about what we believe the expectation is for skincare. When lymphedema therapists talk about skincare, we use the word meticulous. What does meticulous mean? According to the Cambridge Dictionary, meticulous means very careful and with great attention to every detail. When I think about meticulous, I think about homes. I dream about having a beautiful, clean home like you see on HGTV. My son has said to me, "You want the house to look like nobody lives here," which is not true. However, I would love for it to look like there is a great care and attention to detail in cleaning our home. What do you see in this picture? It looks fairly clean. I just put clean sheets on this bed before my helpers arrived. Sometimes it's not what you can see. I know I didn't dust the corners in this room or clean the baseboards, so I did not clean this room with attention to every detail. I am sure you won't find any cobwebs in the corners or dust along the baseboards or fur bunnies floating around the floors of the HGTV homes. The reality is, most of us do not have meticulously clean homes, at least not all the time. Most of us have a more lived-in space. It takes time and effort to clean up just by living in a space. Can you imagine what would happen if you only spent a couple minutes cleaning up, but the dishes continued to stack up? The dirty dishes would soon take over the whole counter, and then eventually the whole kitchen. I think about skincare in a similar way. Skin cells are created continuously, and the old cells on top generally come off with friction, whether from a washcloth, clothing, or by some other means. If there isn't enough friction, the dry skin cells continue to pile up. These can thicken and form large dry skin plaques. This is especially true for individuals with lymphedema who are more likely to have dry skin and a condition called hyperkeratosis. So let's talk about the function of skin. Our skin is truly amazing. I believe we all can agree there is a wide variety of skin types between people, as you can see the difference between the two forearms here. We also have different skin throughout our body. The skin on the bottom of our feet is different from the skin on our thigh, which is different from the skin in our armpit, which is different from the skin on our face. When you have lymphedema, your skin in your affected area is different from the rest of your body. But no matter where our skin is, its main function is the same, which is to protect us. Our skin protects us from everything in our environment, including things we cannot see, such as bacteria. We need to take care of it so it can perform its main function. All it takes is one tiny break in our skin for something to get into our bodies, and the next thing you know, you have a red spot that's swollen, painful, and may smell bad. You may also start to feel feverish or have the chills. These, of course, are the signs and symptoms of infection. Lymphedema increases the risk of infection. This is our why. We need meticulous skincare to prevent infections. So how do we do this? We start by carefully cleaning our skin and nails with great attention to every detail. Sometimes washing our body can be challenging, especially if you have a limb that is heavy with fluid. I find it interesting that many of the individuals I see in the clinic do not report difficulty with taking care of their skin, yet they show signs they are struggling. An area I often see neglected is around the foot and ankle where it's hard to see and reach. To complete skin and nail care meticulously, it takes a long time. I believe many of us rush through the process of bathing. When I was young, I remember being told that a shower shouldn't last more than 5 minutes, which may be enough time if you are on top of your skincare. Unfortunately, that is not enough time to do a thorough job when you have a buildup of dry skin. Tools can be helpful. Grab bars to stabilize your body to reach areas, a chair so you can take your time and maybe get your foot closer to reach, a long-handled loofah, or an extra long washcloth. Everybody's needs are different and there are so many products available. And you don't need to spend a lot of money to get something that is effective. I purchased these products at a dollar store. It is important to use products that are washable, especially important with lymphedema. Using a clean washcloth every time and even multiple clean washcloths when you bathe helps to reduce the risk of infection. If you attach a washcloth to your long-handled tool, you can use a clean washcloth each time and throw it in the washer. If you need help figuring out what tools could work for you, your lymphedema therapist can help you. It could be that you just need help getting the space clean between your toes, or reach to get to your underarm. While this may seem small, this is incredibly important to complete thoroughly, or as we like to say, meticulously. After your skin is clean, we need moisturizer. But before we get to that, we need to thoroughly dry the skin. This is especially important in any place there's skin-on-skin contact, such as between the toes, behind the knees, in the armpits, and in any skin folds. If it is warm out or if you have the tendency to sweat, you may need to use a powder or a moisture-wicking fabric in these spaces. For everywhere else, we need moisturizer to prevent dryness that could lead to skin tears, which can be an opportunity for infection or an opportunity for wounds to form. The type of moisturizer you use is a personal choice, but you want something that your skin responds well to, with a general recommendation for it to be alcohol and fragrance-free. For skin that is under compression, it is recommended to use a low pH lotion. For those with any additional skin conditions such as eczema, you may need the assistance of a dermatologist to find the right product and also make changes with the type of soap and laundry detergent you use. There are many different types of moisturizers available, and you may need more than one to treat your skin. You may choose to use a lighter lotion for day before you put on your compression garment, but then use a heavier cream at night. You may need an ointment for the areas that are extra dry. In general, lotions have more water content than creams, and creams have more water content than ointments. Plant oils such as grapeseed oil and coconut oil may also be helpful in treating dry skin. There are many options, so if you continue to have dry skin, even though you are moisturizing daily, you may need to change what you're using. And why not combine self-MLD in the process of applying lotion? Manual lymphatic drainage stimulates the lymphatic system to speed up and move fluid that is just hanging out. With less fluid in an area, the skin has less pressure against it, which allows it to soften. So MLD is important for skin health. This is also a good time to check for any redness, rashes, or openings in the skin. What else can we do for skincare? We can wear compression to support skin health. I cannot stress enough how important compression is when you have lymphedema. When a limb is swollen with fluid, it puts extra stress on the skin. If skin is dry, it can tear. Long-term stagnation of fluids leads to thickening of the skin and also increases the risk of infection. Consistency with compression is needed for skin health. I often see patients who are doing well with wearing their compression, and then they have one day where they decide to take a break and their limb swells up. The skin often cracks under the rapid increase of fluid, and sometimes blisters form. The best thing to do in this situation is to protect the skin with some type of cream or ointment and apply compression. Short stretch bandages are the first choice. If you are consistent with your compression, cleansing, and moisturizing, your skin will heal quickly. However, consistency is the key to prevent injuries to the skin. Speaking of injuries, there are many things in our environment that pose a risk to our skin, and precautions are needed to avoid injury. Let's start with the sun. It's been beautiful this summer, and many people enjoy being by the water, and it is easy to forget how powerful the sun is and how much time has gone by when you're having a good time. Your compression may offer some protection from the sun, but it doesn't protect your skin that isn't covered. Wearing sunscreen and reapplying when needed is the best way to protect from sunburns. In addition to sunscreen, you may need protective clothing if you are a gardener or like to go hiking in the woods. A scratch or a bug bite can be a port of entry into the body, which could lead to infection. There are many products that help protect us from bug bites, including repellents and products for around the home that reduce their presence. When you are outside, you cannot control everything. Prepare for the risks, keep alert, and give yourself extra time for everything. In contrast of the unpredictability of being outdoors, our home should be our safe space that supports our well-being. With lymphedema, a big portion of the day is filled with self-care. Set yourself up for success. Keep the things you need, such as your compression, moisturizer, pneumatic compression pump, whatever you use daily, in a way that is easy to get to and easy to use. What I mean by this is, if you always sit in your favorite chair in the living room to apply your moisturizer, why not keep the moisturizer next to your favorite chair instead of storing it in the bathroom? Little adjustments can be the difference between getting something done and skipping it for the day. And as much as it pains me to say it, our pets are the biggest risk of injury to our skin and our homes. Recently, I had a patient in the clinic with a new wound on her forearm where she said her cat used her as a launching pad. I have a cat who has decided to live in my walk-in closet, and she pops out for a visit whenever anyone is in the bathroom. If she doesn't get the attention she wants, she will claw your leg. There are many solutions to this situation. I could place her outside the bathroom and close the door. I could distract her with treats. I could pet her to her heart's content. My point in sharing this is that everyone has their own personal situations, and it is important to come up with strategies to reduce our risk of injury to the skin. So what does exercise have to do with skin health? Exercise increases circulation to the skin, which supplies needed oxygen and nutrients. The muscles in our calves, when they contract and relax, are powerful movers of lymph fluid. You don't need fancy equipment or a pool to exercise. Walking is one of the best things you can do for your body, and you can do it almost anywhere. I had a younger patient with lymphedema in both of his legs, and while he had been through lymphedema treatment and had a good compression garments, he continued to get wounds on his legs. When we added in his walking program, which started at just 3 minutes of walking every day, he started showing an improvement in his skin and his wounds started healing. He eventually made it to walking 20 minutes 2 times a day, and he stopped getting new wounds. So I'm a big fan of walking. And if you're unable to walk, seated exercises work great too. And that brings us to the last component of CDT, which is healthy habits. Our skin will tell on us if we're not doing the right stuff. Our skin will tent when we pinch it at the back of our hand if we're dehydrated. We can have bags under our eyes if we don't sleep well. And we can have odd coloring if we're not eating right and getting proper nutrition. Being hydrated, sleeping well, and nourishing our bodies with good food are all important for skin health. While it may not seem like skincare gets a lot of attention, all parts of complete decongestive therapy support healthy skin. Manual lymphatic drainage is important to stimulate the lymphatic system and soften skin. Compression is needed to contain fluid to reduce stress on the skin. Exercise improves circulation and increases lymphatic flow. Healthy habits, including hydration, sleeping, and nutrition, are needed for overall skin health. All of this, along with meticulous cleansing and moisturizing, is needed for skincare with lymphedema. Going back to those beautifully clean HGTV homes, I imagine they must have a large team to get those houses to look so perfect. When you have lymphedema, you also need a good-sized team to help you figure out and manage all that comes along with it. That's what we are here for. Even if we're just here to empower you to take the time you need to care for yourself, we are here to help you. Thank you for giving me the opportunity to speak with you today about skincare. Here are my references. And what questions do you have?
Welcome back. I hope you're all enjoying a fabulous morning of presentations. What I've been noticing is the more I watch and the more I get into it, the closer and closer I pull myself to my computer screen. But as I do that, my head comes forward, my shoulders start to round, my back starts to round, and everything in my posture, although I'm very intrigued in looking at the computer, is pulling me into a position that I don't want to be in. And the more we do this with the front of our body and our shoulders and our chest wall and our rib cage, remember that diaphragm muscle we talked about this morning, that muscle changes position as we pull ourselves forward, as we find ourselves moving and leaning forward to the computer screen. So what I want you to do right now is sit up nice and tall, make sure your feet are flat on the floor, pull your shoulders back, hands on your lap, and let's do 3 more diaphragm breaths. If you still need the feedback of feeling your abdomen move in and out, then you can absolutely put your hands here. So sit up tall, breathe in and fill the abdomen with air, and exhale. If you feel safe and comfortable doing 3, we're going to do 2 more. Breathe in And exhale. And last one, breathe in and fill the belly with air. And exhale. Empty all of the air out of the abdomen and out of the lungs. Now, get back to that tall sitting up position. And let's work some of those muscles on the back of the spine that are stretched out, and also stretch some of the muscles along our chest wall that are getting tighter as we sit here. So with nice, relaxed breathing, I want you to bring your arms up to your side, bring your elbows back behind you, and breathe in. And as you breathe in, raise your hands up to the ceiling. And exhale and come back down. That's 2. We're going to go to 5. 3. 4. And one more. Breathe in and reach up. And exhale, bring the arms down, squeeze the elbows behind your back, get a good stretch and feel those shoulder blade muscles working, and then lower your hands down to your lap. And now we're going to do shoulder rolls backwards. So rolling the shoulders behind you, up, back, down, relaxed. We're going to do 10 of these. This is number 2, 3, 4, 5, 6, 7, 8, 9, and 10. We've now got the blood flowing in our upper back and shoulder area. Let's extend that blood flow into our neck. So again, we want to try and pull the chin back to get out of that forward head position. So your chin and your ears should come back with your ears directly over your shoulders. And we're just going to rotate. Look as far to your right side as you can comfortably. And back to the center. And alternating sides. That's 1. We're going to do 5 of these. 3, 4, and last one. And lastly, let's just drop our ear to our shoulder, get a stretch in the neck a little bit deeper, as far as you can go comfortably. 5 times to each side. This is number 3. 4. And last one. And we'll finish this stretch break with 3 more deep diaphragm breaths in order to stay focused for the end of the day. Breathe in and fill your belly with air. And exhale. Breathe in, fill the belly with air. And exhale. And last one, breathe in. And exhale. Feel free to get up when you need, take a little movement break while you're glued to your seat with anticipation for the next presentation, and I'll see you tomorrow.
Okay, today I get to talk to you about the exercise component of lymphedema treatment and self-management. Okay, I hope to teach you about how exercising actually helps reduce swelling and the symptoms associated with lymphedema, like heaviness, fatigue, hard tissue, difficulty moving. We'll be learning exercises for the entire lymphatic system, like diaphragmatic breathing and cardio, as well as exercises specific to your swelling, whether it's in your arm or your leg. So understanding the lymphatic system is the basis of understanding how exercise actually speeds up our lymphatics to decrease lymphedema. The lymphatic system is a one-way system of smaller lymph capillaries funneling into larger lymph vessels. Each lymph vessel segment has smooth involuntary muscles surrounding it, and when you stimulate it, this smooth muscle contracts and squishes its fluid into the next vessel segment, which then has valves or doors to prevent backflow. So how do we stimulate these smooth muscles to contract and quicken the speed of lymph flow? Well, with MLD or exercise. I'll be focusing on the exercise part. When you exercise, especially with compression on, your muscles bulge intermittently as they contract against those lymph vessels in the veins, which causes the fluid to be moved out of that arm or leg. Exercise is most effective for reducing swelling when you are wearing low stretch compression bandages or garments, or in deep, like chest deep water. The lymphatic system also uses a pressure gradient to move fluid. Unlike the circulatory system, it doesn't have the heart to pump or move fluid. The lymph fluid likes to move from high pressure vessel towards a low pressure vessel, seeking the path of least resistance. You can create this suctioning effect with diaphragmatic breathing and thus improve the flow of lymph. That's why diaphragmatic breathing is essential for anyone with lymphedema. Of course, moving and staying active throughout the day, as well as keeping or getting to a healthy weight, are also very important in self-management of lymphedema. So let's talk about diaphragmatic breathing. As you take a deep belly breath, your diaphragm lowers down and creates more space in the trunk or core area. More space means less pressure. So you create a negative pressure gradient, assisting the fluid to go out of the high pressure in the arms and legs, where the swelling is, to low pressure in the abdomen area, which then flows through the thoracic duct to the lymph nodes at the collarbones right here, and then flows into the venous system at the subclavian veins. Diaphragmatic breathing increases movement of lymph through the thoracic duct, creating like a suctioning effect on the lymphatic system. You will move more fluid out of the tissue spaces of your arms and legs and into the lymph capillaries towards the thoracic duct, and finally at the supraclavicular lymph nodes at the collarbones, helping to reduce edema. The benefits of diaphragmatic breathing is listed on this slide. So decreasing edema by creating a suctioning effect on the lymphatics, which we talked about. It also calms the nervous system or decreases stress, reduces heart rate, increases blood oxygenation or gas exchange, boosts mood and energy, can help improve sleep and decrease body aches and pains. About half of my patients have difficulty getting it, kind of understanding how to do diaphragmatic breathing. I usually assist by pushing my hands on their stomach and asking them to take a deep breath and swelling their tummy out into my hand, causing, extra pressure. It kind of helps help patients understand. The light bulb went on for one of my patients earlier this week when I had her lie down and lay on her back, and she would swell her belly up, and it seemed to work naturally then. So let's review how to do diaphragmatic breathing real quick. I know you've done it a couple times already. All right, start with one hand on the chest and one on the belly to monitor your movement. Slowly take a deep breath in your nose. Focus on trying to get that hand at your belly to swell outward. So like that, while the hand on your chest remains still. You can inhale, try to do it for about 4 seconds, and then hold that breath for 4 seconds, and then exhale as your belly goes in, and then you can pause 4 seconds. You can adjust these numbers, whatever fits for you. Do several times throughout the day. You can also provide resistance with your belly hand or with both hands on your belly before you take a deep breath in. Allowing the belly to win and to swell out with a big breath means you don't resist so strongly that the belly doesn't expand. You can repeat as able up to 5 minutes, but be careful. We don't want anyone hyperventilating or passing out. Listen to your body and advance only as you are able. If you have lymphedema of the arm, these are some exercises that you can do to decrease any tightness in the armpit that may be restricting the flow of the fluid, the lymph flow, out of that arm. So sometimes tightness is from a breast surgery. Maybe the scar is still tight, or if you've had some cording, also called axillary web syndrome, or the tissue is hard or firm after radiation, or perhaps the fascia, which is that thin layer of connective tissue, is just blocking the lymph fluid from normally getting out of the arm. So here are some samples of stretches you can try. Okay, so the first picture, you're looking at the guy and his hand is on the table, and then you look below him where he's starting to lean. So you're kind of using your body to lean and stretch that armpit. You can also do it with your arm out to the side, leaning on the table, and lean sideways. The next picture is she's holding on to, with her hands together, her forearms and elbows are on the wall, and then she stretches up and leans into the armpit. The next two pictures is someone holding onto a counter and leaning their bottom backwards and stretching their chest down to get a gentle stretch. So lots of different pictures. The guy in the middle with the yellow arrow, he's really leaning into it. And the last two pictures are a pectoral stretch across here. Sometimes that's tight, where you put your arms on the wall on either side. One foot's in the corner, and you lean gently into the corner until you feel gentle stretch across here. You can do it in either position of your arm. And what you want to do is get that feeling like, oh yeah, that's the area that's tight. And you don't go to where you're making faces. You go to where you feel a strong but still comfortable stretch. And just kind of change your arm position so it doesn't cause pain anywhere, or your body position. Stretches should be held for at least 30 seconds for the tissue to remember that stretch and actually elongate. You want to continue the stretch maybe three times a day until you don't feel that tightness anywhere. You shouldn't feel any tightness. When normally we're moving, we shouldn't feel any tightness. So that's when you stop doing a particular stretch, when the tissue feels normal and not tight anymore. Just compare it to the other side. One thing I like to teach patients to do is using their opposite hand to stretch on that tight skin or scar tissue. So if you're sliding your arm up the wall and you're leaning on the wall and you feel that stretch and you're like, oh, it's right here, and you can put your hand on that tight tissue and pull down and across steadily to kind of get more of a myofascial stretch. Again, it should be comfortable. It shouldn't be sliding. If it's hard to grip the skin, put your hands skin on skin under your shirt and pull. Okay? All right, let's go to the next slide. So these next exercises are what you can do for arm lymphedema, for kind of contracting the muscles under the bandages or under the compression garments. So any exercise that contracts the arm muscles will help improve lymphatic circulation in that arm. Remember, we said that the muscle bulges against the lymph vessel, which causes that smooth muscle to contract and push the fluid to the next lymph segment, essentially pumping excess fluid out of the arm. Please don't take on the philosophy of no pain, no gain, because pain can actually cause injury like a pulled muscle, and using too heavy of a weight can actually worsen your swelling. So go gentle, listen to your body, and make sure you talk to your doctor about what's safe to do for you. So anytime you have an injury to that arm, whether it's a skin tear or a muscle pull, you're actually causing more blood flow to go to that swollen body part to heal it, which puts more demand on that lymphatic system in there, like flooding of fluid. So don't overwhelm your lymphatic system by overdoing it with exercises. Let's go over what exercises you can do that have the pictures right there. So the first one is like resting your forearm on a table with a small 1 or 2 pound weight and going up and down. Flip your hand around so palms up. You do the same thing. You can do a barbell where you're bending the elbow and straightening the elbow all the way, kind of doing some bicep curls. You can do weights going out like this. You can do one up and then the other up with a weight. And it shouldn't be straining on the neck. If you do both together, it's a little more straining on the neck. So do one at a time, I would suggest. The next few exercises are laying down, which is easier on the body. So if you're laying down, you can do the punching up toward the ceiling with good control. Don't punch up and you don't have control, good control. Or you can do triceps where you just straighten that elbow. Or you can do butterflies where you're coming in toward right in front of you. And then the last one is like some strengthening exercises where you're contracting all the muscles around the shoulder, doing circles with that weight. Okay, again, no pain. These other exercises are similar exercises, but they're using a TheraBand for resistance. So as far as TheraBand, the different colors are different resistances. Again, should be a slight challenge with 10 or 15 reps. It shouldn't be straining and no pain especially. Okay, so with the first picture, he's taken the TheraBand and he's resting his arm on his leg and the band is attached under his foot and he's just lifting his wrist, and then he flips it around and lifts his wrist up with his palm down. Then he's doing his triceps by holding one arm at the chest and pulling away. You can pull down like that, or grabbing one and the one hand, the unaffected arm, and holding it at your thigh and then bending up like you're doing bicep curls with the resistance of the band. This is one of my favorites, is going out to the side. If this is hard to do, do it laying down. It provides good resistance. Again, be gentle with your body. Listen to it. Okay. You can also do diagonals. And a lot of times I like to have the thumbs up when I start and then lead with the up hand with the thumb up. It's just better on the shoulder. Okay. Or you can attach the band to like a door. What I usually do is take a TheraBand and tie a knot in it and then put the knot in the kind of where the hinge is in the door, where the door opens and closes, that hinge part, not at the handle part. And then I open the door, put the knot past it, and then close the door so it secures it. And then you can pull back and do like rows. Or if you put it in the door jamb up high, you can pull down with it and strengthen the arm that way, which would also help pump that fluid out if you're wearing compression. Okay, cardiovascular exercise is very important, especially if your lymphedema is due to cancer. The American Cancer Society says that you are 70% more likely to develop a cardiovascular disease like high blood pressure or stroke or heart attack if you've had cancer. So they recommend that you do 30 minutes of continuous, moderate cardiovascular exercise for 5 days a week, and then some strengthening exercises like the TheraBand ones 2 days a week in order to decrease your risk of cardiovascular disease. What is moderate activity? It should feel like a brisk walk. That's the intensity of the exercise. Not so slow that you don't feel anything. Not so fast that you can't hardly breathe. You want to be able to, talk a little bit, but not deep conversations. You want to have your heart rate going up a little bit. Okay, again, clear it with your doctor. So options for cardio includes, the first picture shows them doing like water aerobics. The second picture shows they're doing swimming. The third picture on the bottom row is bicycling, or you can do stationary bike. The next one is like speed walking. The next one, the lady is doing like a chair aerobics. And the last one is like air boxing. Okay. Clear it with your doctor. Do it within your comfort level. If you're on land, you should wear your compression. If you're in water, you get up to 60 millimeters of pressure at your ankles and lower legs when you're standing in like 3 to 4 feet of water. So chest tight. Okay. Lymphedema is linked with obesity, so keeping a healthy weight is very important. Cardio exercise for greater than 20 minutes actually starts burning fat. So find something you enjoy, find something that you can do continuously for up to 20 minutes to 30 minutes to an hour would be wonderful, at least 3 times a week, in order to make a real lasting improvement in your overall health. Consistency is important. All right, so now we are moving to specifically leg lymphedema exercises. Again, just like the arm, any exercise that contracts the muscles in the calves, the thighs, or the abdomen will help improve lymphatic circulation in that leg. But again, you have to have your compression on to reap the benefits. If you're in the treatment phase of lymphedema, you'll have your compression bandages or maybe some Velcro and elastic compression garments with the straps. And if you're in the management phase of lymphedema, you may just have your compression socks or thigh highs or pantyhose. You may opt to use a stronger, less stretchy garment during exercise to see better results. Exercise is super important for all stages of lymphedema and treatment. So here are some examples of exercises you can do if you're sitting. So the first one, I think everybody probably knows what that one is the ankle pumps, where you lift your toes up and then you lift your heels up. If you just do it in midair, you don't really get any resistance. If you're sitting and your feet are planted on the floor, you're going to get the resistance of the weight of your legs. Okay. The second exercise, they're bending their knees, sliding that towel forward and back. You can also crunch with your toes and get the muscles inside kind of the arch of the foot working as well. The next exercise, they're straightening their knee and then they're bending it back down. The next row of exercise, the lady is bringing her knees together and then spreading it apart. The middle exercise, he's marching his legs. The next one is they're doing trunk rotation. Okay. These last two in the bottom row, he's doing what's called chair push-ups, where you kind of scoot to the edge of your seat. You can put your hands here or on your lap, it doesn't matter. And then you're leaning your body forward and then leaning back with good control. You should feel your tummy muscles working with that. Again, not straining, but working the muscles. You can also, with your arms out to the side, lean left and right. Make sure you're not going to fall. Make sure you're in a safe chair to do that. But that works the muscles of the sides of the trunk. Okay. Here's some examples of standing exercises that you can do. This is one of my favorites for patients who are a little more deconditioned, is the sit to stand. So in that first picture, she's sitting and then she pushes up into standing with good posture and then controlling that sit. If you need to use your hands initially, that is fine. As you get doing it, you can get better at it and stronger at it, but it contracts those muscles in your calves and in your thighs. I usually try to get patients on a good habit of exercise, something like ankle pumps and sit to stands, to do like a lot during the day. So it would be, I try to get them in a habit of doing it every time they've gone to the bathroom. When you're done going to the bathroom, you get back in your chair. I want you to stand up and sit down 5 times. I want you to do some ankle pumps, that kind of thing. So it's really good. The next picture is showing the ankle pumps in the standing position. He's holding on if you need to hold on. Or you can kick your leg in any direction. So she's kicking backwards and then bringing it back, or kicking out to the side. And then the next one, she's bending her knee, so working the hamstring muscle. The next picture with the guy in the blue, he's kind of taking a step to the right. So just kind of stepping left, stepping right, or swaying left and right. If you're really deconditioned and you're like, I can't do much, you can kind of mix up between an exercise in standing and then an exercise in sitting and then back to standing, just to kind of increase your total time of exercising. Maybe you might do it for 10 reps, or you might want to say, I'm going to do it for 30 seconds. All right. 30 seconds are up. Let me try another one. So this gives you some ideas of exercises you can do. The next exercise, he's marching. And then the last one, she's doing squats. And if you need to hold on, you can. Okay, and do it comfortably. I like kind of squats where they look like they're just about to sit down and then they come back. It's usually a good form. All right, so what exercises can you do in the water? We talked about being under the water. The compression helps, providing up to 60 millimeters of mercury of pressure at your lower legs and feet. So I'm a big fan of water exercise, because if you have pain in your back or your joint pain or knee, ankle, hip pain, the that limits your exercise ability on land. The water unweights you about 50%. So it's easier to move, less painful, easier on the joints, safer to work on your balance, less strain. Okay. So the goal is to increase your time and movement in the water safely up to maybe 60 minutes if you're able. The faster you move your leg, the more resistance you get from the water. Be careful if your lower legs are really swollen. I had one gentleman that was kicking his leg out and then it tried to float up. And he was like, oh, he has to be real controlled with him kicking and bringing it back so he doesn't float and lose his balance. Okay. Make sure your skin is intact before you go into the water. And when you get off, you want to wash off the chlorine and make sure you're lotioning appropriately. So the examples in the pictures are, there's a lady walking in the water. It looks like she has a belt on, and that belt kind of holds you up like a flotation device, and you can kind of do the movements without actually touching the ground if you wanted to, like with a life jacket or something on. The second picture is she's jogging in the water, or she's kind of speed walking, doing long steps and doing arms and legs, or marching. The picture on the right, she's doing some squats in the water. You can do lunges, which is like taking a big long step and kind of leaning down a little bit and then coming back up and then do the other leg. It's great for your balance. Again, don't go to pain. Make sure it's comfortable and make sure you're safe if you need to hold on initially to get a feel for what your balance is in the water. Do that. Kicking out to the side, kicking forward, or doing a hamstring curls where you're bending your knee like you're kicking your bottom. I've had many people do water exercises that don't swim. You don't have to swim to do water exercise. It's very safe. Most pools have a lifeguard. You can hold on the railing. Just try it one time. You'll be amazed at how good it feels. Okay, so all these pictures that showed the exercises came from an app called HEP to go. HEP stands for Home Exercise Program in the PT world, physical therapy world. It's a free app with lots of examples of exercises for most every body part. Of course, we as therapists use it to kind of teach, to give people a handout and teach people how to do exercise, and it has instructions, but make sure it's safe for you. Make sure you have medical help with picking out what exercises. I included a summary of my research and a bibliography with my own little summary of why this article might be important to you. Thank you for joining me today.